Hi, everyone. Welcome to the Miracle Larry podcast. I'm joined by best friend Larry Kelly. Larry, how are you?
I'm good, Jack. How are you?
Excellent, excellent. I'm Jack Cush, a rheumatologist of some substandard note, but nonetheless, I get to hang around with some really great people in the field of medicine. We brought one of them onto the program today. This is good friend and true scientist and medical leader, Kevin Winthrop. Dr. Kevin Winthrop is a professor of infectious disease, ophthalmology, and public health at the Oregon Health Science Center in Portland. I've been working with Kevin on a lot of, autoimmune and for many years. And Kevin is a great friend and a great teacher. Kevin, thanks for joining the podcast.
Yeah, thanks, Jack. Appreciate the opportunity to be here and catch up with you guys. So
yes. So I actually went back and listened to the first town hall meeting that you and I did when COVID started. The date
I remember that. Yeah.
The date was April the 2nd, 2020. We were up to here in what we didn't know. And I specifically listened to everything that you said. And man, you were pretty good in your predictions. Like you actually said, when asked the question, like, because you were asked the question by a bunch of people, how long is this going to take? When is this going to end? And your answer was, I don't know. This could go on for a while. But take yourself back to those days when you were, again, neck deep in all the uncertainty and all the unknowns of what is this? How is this being spread? How are we going to deal with it? Can you recall very well what that was like?
Yeah, I can. I remember also being asked that gig that we did, just, is this the new flu or is this any worse than influenza? I remember someone asked that, and I think the answer I gave was, well, it is the new flu. It's going to be around for a long time, but it's way worse than influenza, at least in large subsets of people, which Larry can probably attest to with his experience. So I do remember that, and I think at that time, of course, we didn't know a lot about it, just like you said. I mean, to me, when I go back, what I really didn't know, and I don't think anyone knew then, was just how communicable it was, the airborne spread, and really the key, Jack, the unusual feature was the fact you can spread this without ever being symptomatic. And before you get sick, before you have symptoms, or even never have symptoms, you can spread it to everybody in the room. And that was pretty phenomenal. That was a game changer, and it took a while to figure that out. And boy, I wish we'd figured that out earlier. But yeah, I think we would have saved some lives. But it was just such a unique virus in the way it transmitted and what it did. I mean, it was just it's really scientifically interesting. And it was a game changer.
Kevin, thank you. I can call you Kevin, Dr. Winthrop. But I'm excited that you're here because I have a lot of questions. But for background on me, I was the second patient in New York. So wow. That's how early I was. Right when you were talking about it being brand new, I was that new. I get very defensive on non-believers and anti-researchers and anti-experts. I get there's a part of me, it's hard. Jack always reminds me, don't get political. We don't want to bother anybody. But when you're dealing with COVID in the early days and the research, it's hard not to talk about certain things that came up in society. This was a global pandemic. And I personally feel very, very connected to the virus. I know this virus. I have an intimate relationship with this virus. And I guess my first question for you is, how do you explain the complexity of research to people that have no interest understanding the complexity of research? Like, for example, people thinking Dr. Fauci was confusing. Well, a pandemic is confusing. The virus is confusing, right? If you could talk about, you know, how you have to defeat a virus from a scientist's point of view. Does that make sense? Does that make sense? Yeah.
Yeah, I mean, I can give you a couple just quick thoughts. I mean, first of all, I used to work at CDC, so and I was involved in the anthrax outbreaks and a few other things. But I mean, I just remember, and I was a epidemic intelligence officer, so I was a guy on the ground, you know. But the higher ups handling the press and handling the media, I mean, I just remember thinking how difficult that was because the message was changing every day, just like with this outbreak. The message changes because you have new information, and somehow you have to communicate that and maintain credibility, and that's hard to do. And you know, I think CDC had some difficult times. I think everyone had hard times because everything was changing every day, or you know, very quickly. So you have it's a real skill to be able to communicate and admit what you don't know, but really educate what you're doing about that. And that's the key. I mean, I think Fauci did a good job. You know, I think CDC did a good job with a lot of things. I mean, we can be a Monday morning quarterback. Sure, there were missteps here and there, but you know, I was just having lunch with a close colleague from a former CDC guy who helped run basically the monoclonal antibody distribution program and a number of other things in the face of the whole operation. And I mean, my comment to him was, and I'll say this here, is like, I actually am surprised how well the response went. I mean, if you really look at it and you think like we developed all these new therapeutics and drugs and got all these emergency authorizations and diagnostic assays up the yin yang, all these things in like 12 months time. It's incredible. And not only we were able to make them freely available and distribute them, sure there was difficult to do that with certain things, but I look back on it and think like what an amazing collaboration that took place between FDA and CDC and NIH and industry. Like every company just stepped up and you know said, hey, we're going to play ball. Now sure, the government incentivized a lot of that, and that's what they should have done. But I think as a scientist, having taken part in a lot of that, it gave me some hope for the human race, actually, and for our country. Like
I understand that. I understand.
I felt like we did a lot, and a lot went right, and I'm surprised it went as well as it did, frankly.
Yeah.
So you know what happened? One thing I'll point out perspective-wise, that the people who are against science and the anti-vaxxers and whatever, I mean, everyone's entitled to their opinion and whatever. The interesting thing was they are a lot more vocal, a lot more evident now that the virus is less of a problem.
Yeah.
When this was a gigantic problem, when you were, you know, on a respirator, Larry, there was not a lot of opposition. You know, there was a lot of fear. People didn't know what they didn't know, and so a lot of people hung back to see what was going on. And yeah, maybe they were looking to pin something on someone or whatever, but there was just a lot of fear that was driving behavior back then. But there were so many unknowns. I mean, when we had our town hall meeting with 700 rheumatologists listening to Kevin and 5 other experts, you know, we were arguing amongst ourselves about whether we should be masking, and there were no masks, and there was a shortage of masks, and distancing, and you know how to best treat it, and you know hydroxychloroquine, all this kind of stuff.
That's right. That was the hydroxychloroquine days. Yeah, that's right. I forgot about that.
Oh yeah,
Jeez.
yeah.
You know, Jack, but I'm a patient, right? I'm the citizen, so I'm every man, right? In a global pandemic or a coronavirus, you should be getting all your advice from the experts. Yes, I mean that.
Well, Larry, anybody with a website is an expert. Anyone with a megaphone is an expert, and that's the problem. And here's my favorite quote from a marketing guru, Seth Godin. I hope I haven't said this before. Seth Godin says, "Nobody believes what you tell them. Nobody believes what you show them. They often believe their friends. They always believe the story they tell themselves." This is what you're up against when you're a scientist like Kevin, who has the evidence, who has the numbers. He's a on-the-ground epidemiologist who's counting bugs and giving the evidence that informs decisions. But again, when you're up with the individual who what's the story they're telling themselves? and amidst all the fear, there was a lot more listening and a lot less talking by those folks. But now there is a lot of open opinion, and I still think that science and numbers don't lie. I mean, and science really can change over time, but still.
I think Kevin brought it up that there's a lot of Monday morning quarterbacking that's going on now, more than there was back then, because people do want to move on. I understand that impulse. I understand that. In my case, I don't think it will never not be a part of my life, and it's.
And you're not every man.
It's hard for me to,
Larry, you're not every man. You're a miracle every man.
I know, but
and you obviously went through something that not many people who've had COVID went through that. You were on the forefront, and it was the worst. That first year of COVID, we saw a lot of morbidity and mortality. It's gradually lessened for a variety of reasons. The variants are less aggressive, and also we have all these vaccines and therapeutics now that we didn't have when you were experiencing this. So, I guess again, I try to look. I'm an optimist, glass half full guy. So, I just, as much as I wish we'd had masks. I wish we'd told people to mask. I never thought we should close the schools. I mean, I have my own criticisms about certain things.
Mm-hmm.
There was no right answer to these things at the time. It was a judgment call. But by and large, I think the health authorities in this country stepped up and did a great job. And that's at the local level, state level, CDC level, FDA, NIH, HHS. I mean, it was.
I do too. I agree. I do too.
Yeah, and again, industry. I mean, I worked. Jack and I, we did a lot of work with industry trying to get these vaccines and drugs available. And I mean, no one really had to spend $300 million running a bunch of phase 2 and 3 trials on a drug that they're never going to make money on, right? I mean, there was a lot of people just doing this because that was the right thing to do.
Right.
And I guess you could always be a cynic and say, well, but they knew that, if everyone dies, no one's going to be around to buy Humira, so we better do something about it. I don't know. But I mean, my experience was people of all walks, scientists, clinicians, you name it, no matter who you worked for, whether it was a company or a government or whoever, everyone wanted to work together and get to the bottom of this and try to solve this problem. And it was I think a very positive experience in that way. So,
Kevin, let me ask you about where we stand now on masking and what we've learned from masking. So, and this is still a big issue because the numbers on COVID in the last 2 months show rises in COVID hospitalizations, rises in COVID deaths. Again, we went from a really low number to 7%, 10% rises, and it's hard to say what this all means. But what is the take-home message on masking that people should be practicing even now, and should people be masking at all now?
Yeah, that's a good question. I mean, I think on a population level, masking, you could do a study masking, and you're not going to see any benefit. You're not going to see any harm either. but you're not going to see
exactly.
You have all this vaccine and prior infection associated immunity. You've got antivirals. You have all these things that you're not going to be able to measure benefit of masking. So I don't think in the general population there's rationale for doing it. There's a debate in the healthcare setting whether or not people should be doing it. And every institution is different. I don't know what you guys are doing. We've relaxed it. I think most places have relaxed it, but there's a lot of people calling for it to be, reinstituted, particularly during the winter, months with respiratory viral season. So, there probably is some rationale to that, or at least in certain settings in the medical institution, particularly the immunosuppressed setting. I don't know. I mean, I think it's largely an individual decision. I mean, I was on the tube in London the other day, and I actually put my mask on because it was 5 people coughing in my tube car, and it was 90 degrees, and it was packed. I was like, this is terrible. I'm putting a mask on. I was the only guy, but I didn't care.
Yeah, I still carry one on the subway. I still carry one, and whether they're coughing or not, if they look sickly to me, I put
Yeah.
my
Well, and to be honest, I'm not necessarily afraid of getting it and dying from it or something.
Neither am
But
I. It's
I don't
weird.
want it to wreck my vacation. I mean, that was it. It's like I'm on vacation. I don't want to get a bad cold or flu for the next week.
Mhm.
Feel like crap. So, I I think the morbidity and
Did
mortality
you
from
ever get it, Kevin? Did you ever
uh
get it?
I have had it. Yeah, I got Delta back, a year and a half or 2 years ago, whenever that was, year and a half ago, almost 2 years ago. So, and I actually got pretty sick. I didn't end up in the hospital, but I sure thought I was going to,
Mhm.
the way I felt. So, in fact, I went in and got checked out and X-rayed and all this other stuff. So, but that was at a time I got that kind of similar to you. Well, there was no antibodies that worked anymore, and there was no antivirals available. So there was nothing for outpatients. There was stuff for inpatients, like if you were really sick, Actemra and things like that. But so there was nothing to try to prevent you from getting worse, which now we have, good tools to prevent people from getting worse who have high risk factors. So,
Mhm.
Hmm.
Yeah, no, I was so early that it was like everything on the shelf. I think they stuck in me. So it's like,
well, it sounds like you got,
they said I was like
got
the Pillsbury Doughboy who after one point I was so puffy.
yeah, well, you at least ended up getting some things that later turned out to actually have some benefit, the
Yeah, I
steroids
think so. I think
and the
so. Jackson.
tocilizumab. So, yeah.
Yeah, I think so. I hope so. You know.
Who was calling the shots where you were working at the Health Science Center on COVID, Kevin? I mean,
Well,
how did that work within the hospital?
yeah, I mean, the hospital, we had a committee. I was not on that committee. I was on a vaccine committee related to vaccine distribution. But in terms of infection control and, what therapies to use and whatnot, we had a committee, a couple of my colleagues from the ID division and a few other folks. But, I will say, people really followed the local health guidance quite closely. Our state health department is an excellent health department as far as state health departments go. Um, I think they largely made right calls all the way. I mean, there's a few things I disagree with here and there, but and again, it was fairly conservative out in liberal Oregon. I mean, we
Mhm.
never saw the disease numbers. We never had curves like that occurred in Florida or New York or the other places. I mean, and largely because we were late and we shut down and people masked and they stayed away from each other, and it really did minimize disease, particularly in that first year and a half. So.
Well, I always argue with people that I present the argument. I don't argue with people. I use the term argument and it's a conversation only. But that in many ways, an authoritarian society is better equipped for global pandemics than a free society because, shutting down, sometimes you have to do it. If you're depending on the severity of the virus, I'm assuming, how else do you attack it in the beginning without,
Yeah. I mean,
taking a total precaution?
I was not without my, I was angry. They shut down the national forest. We couldn't go hiking. I was like, you gotta be kidding me, right? I mean, there was something overreactions. It made zero scientific sense. Zero. So there were things that I would stand up and argue about, or I'd write a letter about, whatever. But I mean, you know, largely speaking, different places in the country handled this differently. I think earlier on, when there was less known, it was more fear, and you had more virulent virus, less treatments. I mean, probably there was more cohesion in terms of nationally what people were doing, but that obviously kind of just changed as we went along. I mean, if you have friends overseas, I mean, Jack and I travel all over the place. I mean, like a lot of our friends and colleagues, they were like locked in their apartments in Italy for like
I know.
3 months. I mean, they didn't even get out. Or
Australia,
Canada,
so
even Canada, or they got out and they got fined by some police officer who's walking around. I mean, it was very different in a lot of places, not to mention certain parts of Asia where it was very, very different. So,
Yeah.
So Kevin, this is a question that I think has plagued Larry a little bit. When Larry first came down with the infection in early March, he was pretty much arm in arm doing a lot of activities with his wife and his younger daughter.
yeah.
And the wife never got infected. His younger daughter got infected, and Larry got infected. The daughter stayed at home and quarantined and got through it. Larry ended up in the hospital. Why those three scenarios when they're probably all exposed to the bug. Do you have any understanding?
Yeah. So your daughter did get infected or didn't?
Yes, she did. My
She
wife
did.
actually had antibodies at one point, so she obviously got it too, but had no
Yeah.
symptoms. My wife is made out of iron, so it's a.
Yeah, I mean, when I got Delta, we went to Sun Valley. My daughter was working as a ski instructor there, and we had Christmas there, and all five of us shared a little condo, and she brought it. She basically gave it to us all for Christmas. And myself, my daughter, my son, and we all had it. But my wife, who was in the same little tiny condo the entire time, and then we drove for 16 hours through the snowstorm to Oregon with the windows up because it was -4 out. She never got it. I don't know how.
But that's the nature of the virus, right? So that's the hard stuff to explain, right? That's everybody asks me, where did you get it?
Well, the answer, Larry, and we all know this, women are just better. And that's the deal.
Women must be married.
Women are they're just better. I
mean,
and I'm joking, but I'm kind of not. Like,
I'm not joking. I agree with you totally.
No, immunologically, they do better with most infections. TB, COVID. I mean, you can name a lot of things. There is a difference in survival, and females almost always are better at surviving than males. And I'm sure there's a variety of factors associated with that, but in the end, they do seem to be the fitter.
Well, I went back to the theater after I retired, right? And I was doing shows in Jersey, and Bergen County was another epicenter, New York City, Bergen County. So I was in the exact two spots that happened to be the epicenter. But I'll never know, and I told this to Jack, the entire cast that I was doing this show in Bergen County got sick. I was the oldest and the sickest, but I'll never know if I gave it to them or gave it to me. I never really will know the answer to that. And so that goes to my next question to you, Kim. And this is not political, but it's on my mind. Is it really important for us to know what benefit do we get knowing where this virus started? Is there any real benefit in that? Like, why is there so much effort to find out where it started?
Well, I don't know why that became a political question, because it doesn't make any sense. It shouldn't be. B, I mean, I can tell you if I had to guess, I bet it did come out of a lab, because they haven't found it in any animals yet. And at this point, it's hard for me to believe that we wouldn't have found it in all these animals that have been tested. That being said, I think your answer you're wondering about is like, does it matter? No, it doesn't matter to me where it came from. I think it was accidental, whether it came out of some sort of weird mink in China or if it came out of a lab or something. I don't think it matters, but I mean, it is useful to know, I think, because if it did come out of a lab, it'd be nice to know how it happened, so you could potentially prevent that type of thing.
Right. If it was I would like to believe it's accidental, that somebody wants to find something nefarious in this virus. And, my relationship with it, again, is sort of intimate. And, it only has one purpose, and that's to kill us all. So we just have to defeat it. And I don't care where it came from, actually, as long as we eliminate it. And
I mean, I think if we found an animal reservoir, I mean, that could be useful too, to understand the dynamics of how it jumped a species barrier. So I do think there's value.
That makes sense. You're right.
But going back to the other question, I will just give you my scientific answer. It's like, I think, it's very clear now that a lot of our immunity and ability to prevent severe disease has to do with our T cell, like our cell mediated immunity. And our cross-protective responses to other similar viruses. And, I think those cross-protective experiences and T-cell responses, which is part of your immune system, a lot of that probably more prevalent in certain groups of people, like kids. They're more close in touch with all these other adenoviruses and other things. And maybe that's true too of women versus men, just because they're more likely to be closer to their kids. I don't know. I mean, these are all theories, but I think it's very clear that and we even see this with influenza and other things. I mean, your experience with other related viruses certainly can become protective against subsequent viruses. And I think that did explain a lot of the disparity we saw in terms of why some people got super sick and some people didn't get sick, or some people had symptoms and blah, blah, blah. So
Kevin, is it true that Larry, who was infected with the bug and later was vaccinated, that he may very well be the most protected compared to me, I was never infected but just got the vaccine?
yeah, well, there was a lot of work done that first year to year and a half. I mean, looking at the protection afforded by vaccine alone, or natural infection alone, or the combination, and it was pretty clear the combination was more potent in terms of higher antibody levels and probably more robust immunity, at least for some time period after those events. There was definitely the work done looking at severity of disease, and the people who had really severe trips with COVID, like you did, they definitely developed higher antibody levels and probably greater levels of protection that then may last a little bit longer, right? Because all your antibody levels are going to wane, but if you start higher, 6 months later, you're still probably going to be higher than the next guy who started lower. So, I do think that there is some truth to that, and I mean now it probably doesn't matter. But
people say to me, they always say, well, "You must have lots of antibodies," and I make them feel good and joke and say, I got them coming out my butt. I got antibodies out the antibodies. I said, I don't know that. But here's Kevin, here's where I'm at. And I know I'm kidding myself in this, but because of my lucidity throughout the whole ordeal, and even in the coma, I have this false belief that there's no way that someone or something would make me go through that again. Do you know what I mean? It's sort of like, for lack of a better word, on a spiritual level, but it's on a. I just.
Like the world according to Garp, you're disaster proof. Like
exactly. When the plane hit the roof, it's like that'll never happen again. I'll buy this house.
Okay.
I'm the guy you want to have dinner with.
We can't use these words.
You're safe as hell.
As doctors, Larry, we can't use this strategy in trying to sell our concept.
I know.
But I'm glad you're comforted by it. That's good.
Well, Larry, I think you're right. I don't think you're going to go through this again with COVID. That's for sure.
Yeah.
I mean, so that's good. You have gained some, I'm sure, quite a bit of protection against future, SARS-CoV-2 or related viruses, even. So, I think what you
Kevin,
went
that's
through.
my next question to you is: do you think, you're younger than I am, and we are, Jack and I are. Do you think we're going to see another one in our lifetime?
Another pandemic, or?
Hmm?
Well, I mean, there was SARS or SARS-CoV-2, there was MERS. I mean, these things seem to pop up every 10 years, the last 20 years. So if you just look at that as your stock ticker, it's probably going to pop up. Something's going to pop up in the next 10 years. Yeah, I mean, there's no question we'll have more pandemics. I think probably the next 15, 20 years, there's a good chance we'll see something.
Mm-hmm.
And it may be worse or better. I mean, I think that's just random. Like, it may be something that we already got therapies to. It may be something that we've got a lot of cross protection to based on experience with other viruses, or it may not be. You just don't know. So, but I do think the next one might go better in terms of response, from government. I mean, the whole response, right? So we definitely learned a lot. I think those things will be put to use in the future.
Good. That's comforting.
Every outbreak, you learn something, and it makes the next one better. I mean, it doesn't matter what the disease is. And so I do think CDC will be better prepared, for example, and whatnot. So, but of course, if the next pandemic's not for 30 or 40 years and everyone, institutional memory lapses and funding lapses and all that, then my statement goes by the wayside, because then it'll be like starting over again.
Yeah. Like, who knows who Jonas Salk is, right?
Yeah, right. Yeah, so we'll see. Hopefully, I guess that'd be the good thing if we had the next one sooner than later, but it'd be nice not to have the next one for all the time. I think there was quite a bit of exhaustion on the part of society, and all of us personally, right? I mean, that was not something anyone really wants to do again for a while. So,
Kevin, here's a random question.
yeah.
Only because of where you live, and my dearest friend in the world lives there also. And there's a severe homeless problem in Portland. Do you find any infections in the population? Is there an increase in infections in the population?
No, I mean, there's a severe homeless problem, not just Portland. I would say every West Coast city, particularly,
Yeah.
but also other cities in the U.S. And you can kind of see it's been growing the last few years. I think the pandemic definitely contributed to that. It definitely contributed to that in Portland, and I think other cities where the downtown's shut down. There's nobody working there anymore, and it's a problem. So I think that's happened in a lot of places. Certainly, Portland's been one of those places, and it has been hard to see. And I think things are starting to get a little better now, which is good. And a lot of it had to do with opening up. We just need to open up our businesses and society, and people need to start working again, not just from home 24/7. So,
But numbers wise, data wise, you don't find an increase in
No.
infections in that population.
I mean, for example, our tuberculosis rate, which use homelessness as a risk factor, that's stayed totally stable. So we don't see any particular infection problems. We see a lot of mental health problems. It's definitely a pandemic of mental health problems and drug abuse that coexist, and that's I think that's rampant homeless populations everywhere in the U.S., probably beyond the U.S. But I wish I had some expertise in.
I tell this story. I tell this story, Kevin, that in terms of mental health, when I first came home, there was all this pressure on me to live up to this name, that I was this miracle all of a sudden, and
Miracle Larry.
but 3 months in, I'm like totally depressed. I'm like, but so it's COVID, remember, it's like we're talking September of 2020. So I start calling psychologists, and I'm telling them that I think I have suicide ideation, and they're giving me appointments for 3 months down the road. I'm saying, what you don't understand. I'm calling you for suicide ideation, and this is March, and you're saying, well, you can come in May. You can come in. So I know that my sense of humor is hopefully one of the things that got me through it, but it was not easy. It was not easy mental health wise.
I would say that's a funny story. The wait time to see specialists and primary care doctors is too long in this country. We all experience that.
But it coincides with the wait time to get a gun license. So you're okay.
It's probably less than 3 months in Texas, wherever you guys are.
Don't take it there, Jack. You told me don't go there.
That's a good place to end. Kevin, thank you so much for letting us scratch your brain and all that wisdom on this great subject. And
really, thank you, Kevin.
We really appreciate your perspective.
And,
good luck, and Larry, I'm glad you made it, and I'm glad you're doing your podcast.
I'm glad you do. I love that you do what you do, Kevin. And
well, thanks. I'm optimistic. I think we got a lot of tools now, and we'll have more in the next 6 months, 12 months. So I think this is going to be a problem for specific subgroups of people more than anything.
You notice anything coming up, send me a note.
I will.
No, don't eat oysters, whatever. Just send me a note. Send me a note.
Well, don't eat oysters, but you should grill them.